Hi everyone, I'm Diana Baraney from Children's Hospital Wisconsin, and I'll be sharing today some bright spots in outcome and process data from a pilot project addressing essential human needs at Children's. My department, Population Health, is tasked with designing new models of care that improve AAA outcomes and that can be sustained through value-based contracts. We use an evidence-based process and engage people throughout our system and community who may be impacted by new models of care. Access to quality health care accounts for about 10% of health. But things like the lack of adequate food, jobs, or housing, for example, can attribute to people's poorer health. With this in mind, we at Children's designed a program called Clinical Navigation to connect patients with their families with resources outside of the clinic. We hypothesize that screening for and addressing these essential human needs will improve patient health, improve experience for providers and patients, and lower total cost of care over time. This is our process. So we used a standard 10-category screener, and all patients checking into clinics were screened for social needs. If a patient did identify any needs, they worked with a navigator to connect with resources in a community such as Goodwill, SNAP, or WIC. And in some instances, follow-ups were done by phone to see how the patients fared. And we were also able to document this information in the electronic health record so care teams could use it. This initiative really intended to connect medicine and community as equal partners in achieving optimal health. The doctor is no more or less a healthcare provider, as is the woman working at a food pantry or a community. Our workforce included students, and many of the students were going into medical fields. They told us that they gained an understanding of social needs that they will be using in their future in practice of medicine. One navigator stated that they found it extremely rewarding that people are so appreciative and willing to share their struggles as we help them to find beneficial resources. And the impact on students was a bright spot in our program. In order to measure experience, we polled both families and providers using this program. And overall, both groups really liked the program and believed addressing social needs could impact and improve health. We were concerned that patients and families may not accept or use this program. We found that patients did feel valued and heard. They are more likely to discuss non-health related issues with their primary care physicians. And at the outset, providers were concerned that adding clinical navigation would impede their workflows and extend appointment times. Another bright spot we found was that providers actually had more time to treat their patients and felt more comfortable discussing social needs. We screened about 90% of the patients arriving for visits during a 3-year period. We found that 20% had needs, and of the visits with needs, 51% were successfully connected with a resource. Also, we found that needs exist across populations. So this graph shows that regardless of payer type, all of the needs were essentially the same. They were jobs, housing, food, and childcare. This map shows an example of where our clinics are located. Our clinics that we're screening are the purple dots, and the needs are all across our community. Abnormal depression screens for kids 12 and older were 40% higher for patients with 2 to 3 reported needs versus those with 1 or no needs. And this is scary because the caregivers are the ones reporting the needs, not the children. So you can see how kids are affected. And for patients with asthma, the ACT TRACK score denotes how well asthma is being managed. And you can see that the fewer social needs reported, the lower the percent of abnormal TRACK scores were seen, so the better patients were managed. We also found that emergency care and urgent care was higher for patients with a need versus those that never had a need, and patients with needs used more sick care. But one of the biggest bright spots in our data was the fact that social health screening was associated with statistically significant declines in the total cost of care after the screening for a period of 18 months. So that was kind of cool. Unresolved social needs affects health. Children's is incorporating the knowledge gained through this pilot in a system-wide strategy to make this type of screen a standard of care overall for all patients. That's what I got.